Today I'm going to demonstrate how to perform a central line dressing change. To perform this procedure, you will need a dressing change tray, a stat lock, a mask for yourself and for your patient. I have alcohol pads, a bio patch. In the clinical setting, you'll see the bio patch has a blue side and a foam side. The blue side goes to the sky. In the nursing resource lab here, your bio patch is already in your kit and it's white on both sides, so be aware of that change in clinical. I have flushes, I have new caps, gloves, and sanitizer. I'm going to go into my patient's room, wash my hands, introduce myself. Hi, I'm Jody. I'm going to be your nurse today. We are going to change your central line dressing. Is that okay with you? I would confirm that my patient is who he is supposed to be with his name and date of birth, confirm that there's no allergies. I already have my bed in the air, but I would raise the bed, put the side rail down. I'm going to put a mask on my patient and ask him to turn his head to the side to reduce the risk of infection once I have the dressing off his line. I'm going to apply a mask to myself. Expose the area of just where the line is. And to remove the dressing, you can use clean gloves. The dressing change is typically done every 7 days, 5 to 7 days, depending on your hospital. And it would also need to be done if you noticed that the dressing was coming up in any areas or if it looked soiled and needed to be changed. To remove the dressing, I'm going to pull in towards the insertion site. My stat lock will stay in place for now. I'm going to have to use alcohol to remove it. So I will remove the dressing and my bio patch. Take alcohol to help me loosen my stat lock and open these little wings, these little doors to get my line out. Now be aware that your line is loose, so you want to make sure that it's not going to move out of place. Take off your old gloves and wash your hands. Alright, I'm going to get all of my supplies set up that I will need. Open your dressing change tray. You'll see that there's a mask in here. You don't need this since you're already wearing one. I'm going to open my stat lock and just leave it sitting on the paper here. This stat lock comes with a little piece of tape and alcohol, skin prep for the skin so that it helps adhering and so that the stat lock doesn't damage the skin underneath it. Take out my sterile gloves. Okay, now in order to hold my line while I'm cleaning, I'm going to use gauze. And I'm going to take my ChloraPrep out. To break this, you just squeeze the little arms together and then you want to press down to make sure that it's going onto your pad. I'm going to take my gauze to help me hold the line. And then I'm going to clean starting at the insertion site working my way out, scrubbing back and forth motion. And then I want to clean down my line. Give this time to dry. I'm going to take my BioPatch and apply that onto the line. And then I would take my Skin Prep I'm going to clean underneath the skin where the Statlock is going to go. Allow that to dry. And then I'm going to take my new Statlock, line up the little wings with the holes, and make sure that I secure the doors before I secure this to my patient. Pull back on the little wings on the back of the dressing to secure. Then I'm going to take my transparent dressing, remove the backing, and apply over the BioPatch and the Statlock. The paper that's on the end of this is used, once you start pulling this, you have to press down on the dressing to help it adhere to the skin. And then I'm going to place my date, time, and initials on the dressing. Another piece of this is changing the caps on the ends of the lines. So normally once you're doing your dressing change, you're also going to be changing the caps as well. I'm going to demonstrate how to just change one of the caps. So in order to do that, you would need new caps, one for each lumen, a flush for each lumen, and alcohol. I get my caps prepped and ready to go before I remove the old cap. So to do this, you open your cap. You want to leave this blue piece in place because this is what's going to be coming into contact with the line. Take the end off of your saline, attach, and then you want to prime the cap so that we're not going to be giving our patient any air. And then I set this inside of here. To remove the cap, first you want to make sure that your line is clamped. If your line is not clamped and we remove this cap, blood is going to start flowing out. So we clamp here. Once I remove this old cap, I'm going to clean the hub with alcohol and allow that to dry. So scrub the hub at least 15 seconds. Allow this to dry. I'll take this blue off the top of my cap and screw on to the new cap, and then I can unclamp my line and flush to make sure that it's working, and then make sure you reclamp your line. This is done with the other two lumens as well, with each dressing change. This concludes the video on central line dressing change.